Thank you for listening to GCN. Be sure to visit GCNlive.com today.
Well, I want to talk about how to save yourself and your kids. Okay, there's so many terrible accidents. There's so many infections. There's so many mistakes that result in death to the patient or harm to the patient, permanent harm. And you can avoid all this by doing most of your health stuff yourself. And I like to start out with lab work. You need to do lab work on a regular basis once a month because you can go to a pharmacy without a prescription and you can get test strips for urine tests. You get test strips for blood work. You get test strips, which are the equivalent of a colonoscopic exam. And it's safe because you're not going to kill yourself doing these things, right? And there's things you can do. And these test strips, for the most part, cost about $1.50 each. You can get them in bottles of 5 or 10. And you need to have a family meeting at least once a month, better yet once a week. And even if people are distances, you can do phone conferences, right? And Skype and that kind of stuff. And actually share information with each other. And you want to engage these little kids in your family. You know, even if they're only 6 months old, they need to be listening to what you're saying. And then they're a year old. And at a year old, they like to put the test strip in their own urine and that kind of stuff. They see you writing their information in the book. By the time they're 2 or 3, they can do all their own stuff. And you can kind of supervise them, right? And by the time they're 6 years old, they will not go a week without doing their own laboratory work. Now, this is going to save you an enormous amount of time and misery down the line. It'll save you an enormous amount of money immediately, and it's going to be safe. So once you get a hold of the book, Dead Doctors Don't Lie, and find out why you need to do this stuff, get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. It's kind of like a 25-year update on the book Dead Doctors Don't Lie, but it doesn't give any of the old information, so you have to have both books. And then you want the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. And you can actually learn what numbers mean. You can learn how to do a 6-hour glucose tolerance test to see if you have reactive hypoglycemia or diabetes. Again, you can do the equivalent to a colonoscopic exam. Costs you $1.50. You do it yourself. And it tells you what to do if you find something positive here. In many cases, you can still do things yourself and not have to worry about going to a doctor. There's a few items you may have to go to a doctor for. And the books actually guide you in the right direction. Type 2 diabetes makes up 98% of the diabetic population. And it's not genetic, as doctors will have you believe. It's actually a deficiency of a single nutrient, a single mineral. We've known that for 85 years. And it's easy to diagnose and easy to manage and give your body what it needs. Your own genes, DNA, RNA, and telomeres will make everything happen in the right rails. Obesity has nothing to do with lack of exercise or eating too much. Obesity is actually a deficiency of any one of the nutrients in a certain class of nutrients. And any one of those missing, of course, you gain weight. And there's 3 of them. If you're deficient in any one of those 3, God forbid all 3, you're going to be the 400-pound, 600-pound, 800-pound, 1,200-pound person. And then, so you take the 90 essential nutrients and you get on a little bit of a diet, not so much avoid calories. You don't even need to exercise. You'll be losing a half a pound to 2 pounds a day. And then there's arthritis. Well, my doctor said, you can't regrow cartilage and I need a double knee replacement. Well, with all due respect, your doctor's lying to you. Your body can regrow cartilage. It just needs raw materials. You see, genes, DNA, RNA, and telomeres are just blueprints. They require stuff to be able to do their jobs. And this is where doctors say, oh, here, if you want to try it, go get you some calcium. Well, calcium is not going to do it. You need all 90 essential nutrients, a little bit of extra, the secret sauce that's required by the genes, DNA, RNA, and telomeres to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone mixture, bone cell. Another common one is GI stuff, gastrointestinal stuff. We're talking about gluten intolerance is one of the biggest ones, like 85 to 90% of all humans. It's not just Americans, but all humans have a gluten intolerance. It can show up as appendicitis, colitis, ulcerative colitis, irritable bowel syndrome, inflammatory bowel disease, diverticulitis, Crohn's disease, and of course, any of these diseases, you get on a gluten-free diet, you take your 90 essential nutrients, your body will repair itself. You don't need to have your colon removed in most cases. A lot of times they will purposely misdiagnose you. They say, oh my gosh, we did the colonoscopic exam and you have colon cancer. And they can even show you pictures. And even colitis is going to look pretty ugly. It's going to look like cancer. It's not cancer, okay? When you have irritable bowel syndrome or you have benign polyps, you don't need to take your colon out. There's things you can do with diet, just like a gluten-free diet. Get rid of all the bad stuff, no fried foods, no processed meats, no oils, no gluten, and your body can heal itself, including your colon. But my doctor said, well, if you follow his instructions, the odds are you're going to be damaged or dead. So get a hold of the books, Dead Doctors Don't Lie, Epigenetics, Let's Be Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. Save yourself. Save your kids. Save your family. Save your church mate. Save your pastor. And we'll save America. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, this is another example of medical mistakes that end up, really affecting someone's life. As I've got a story here from Fox News that says, docs attached woman's colon to her vagina in botched cancer surgery.
What?
This coming from Central European News.
They don't know the difference in anatomy? Holy moly.
Yeah, this is over in Europe, and they say a woman underwent surgery to remove skin cancer, left the hospital with a different result. As doctors mistakenly attached her colon to her vagina, causing her to relieve gas through her genitals. Reported that 3 years after the error occurred, she's now speaking out about the botched procedure to put pressure on the Macedonia hospital that promised her more than $33,000 as compensation for the error, but she's still waiting to get about a third of that, about $11,000. Said, while I was recovering, the doctors came in and asked me if I was passing gas, and I said yes, but it's coming out of my vagina. They told me that would soon pass and I would be okay, but stuff started coming out of my vagina, and I started feeling scared, and it was all very unpleasant. Reportedly discovered the mistake after receiving an x-ray that not only showed that her vagina and colon had been tied together, but the carcinoma was still intact, so she opted to have the skin cancer removed at another institution. Don't blame her. Her lawyers have reached an agreement with the hospital managers outside of court, indicating the hospital would pay her about $33,000. She's still waiting for $11,000 of that. The hospital manager said insurance only partially paid the compensation and that it cannot pay any more without a court order. She and her family plan to sue. I don't blame them.
Yeah, $33,000 for that?
Yeah.
She should get $300 million.
Yeah, really.
She should own the hospital. Okay, I mean, these doctors don't even know the difference between her vaginal tract and her colon. I wonder if that doctor was intoxicated, with alcohol or something. There had to be something very, very wrong there. And they didn't even remove the skin cancer, which was the original reason she went in there for the surgery.
Yeah, exactly.
I mean, this is one of the craziest things I've ever heard. And so you should email her and say, I'll be happy to be an expert witness or nothing for that one. Oh, my gosh. Okay, well, again, I would urge people to get a hold of the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, the Passport to Aromatherapy. We teach people how to actually remove themselves. They can actually remove things like skin tags and benign papillomas, which are almost like warts or things like that. We can teach them how to do all that stuff themselves. And here's a case where I guess she probably didn't get a second opinion before she decided to follow the doctor's instructions, get the surgery. And here's a case where I think in the United States, this happens so often. The deaths is 251,000 deaths in America from mistakes each year. That's a yearly figure, 251,688 per day, deaths from simple mistakes. And then you have these kinds of things. 15 million are killed, injured, and infected. This would be an injury thing to me. 15 million are killed, injured, and infected each year in America by doctors. And they don't even get an OSHA ticket. And so I think we should have the state legislatures come out and insist that doctors, before they go in the surgery room, should have a breathalyzer test to make sure they're not intoxicated with alcohol. They should pee in a cup in front of a nurse so we know it's their urine. and the nurse should put a test strip in the urine, which will screen for drugs, okay, particularly narcotic drugs, opioids, and heroin, and stuff like that. And that way they don't have to stick them 5 times a day and draw a blood sample 5 times a day. We can just test their urine for a screen, see if they have drugs in there. But, this doctor should have his license taken away forever. Or maybe have his colon attached to his genital tract. That would be a good treatment or punishment. Well, stick with us. We're back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Chicago, Illinois. And Tom, you're on with Dr. Wallach.
Hello, Tom, you're on the air.
Good afternoon, Dr. Wallach.
Yes, sir. How can we help you?
I have 2 questions for you. How does a person get Dupuytren's disease, and has it ever been reversed?
Yeah, this is where their wrist curls over.
Well, it's the cord in the palm that brings the fingers in.
Okay. This is, okay, so they have trigger fingers. That is a common name for that. Okay. And so it could be one finger, it could be all fingers, and it can happen where the whole wrist is curled over in the flexed position, can't straighten out. They can get hammer toes, where the toes are doing the same thing, curling under the feet. And this is a shortening of the flexor tendons. And here's a case where they need the raw materials for the body to support and promote maintenance repair of those tendons. Okay, it's not a genetic thing. It's just lack of nutrition. And the tendons get shorter and shorter and shorter because there's not enough raw materials to have tendons of the proper length. And so hammer toes, trigger fingers, and as you say, Dupuytren's contracture, it can be the wrist curling over too. So it'd be, I like to throw in the kitchen towel with them, throw in the 90 essential nutrients, and I like to use a heavy hammer here. So it'd be 1 healthy brain and heart pack per month per 100 pounds of body weight. And then I would also, if they only weigh 100 pounds, I would throw in another bottle of these Ultimate Selenium, so they can have 6 of those a day because of the cofactors in the selenium are also necessary as cofactors to help rebuild and support maintenance repair of the tendons, ligaments, connective tissue involved here. And I would also use the CM cream and the trauma oil topically to relieve inflammation and allow for some relaxation there. They can do a little bit of physical therapy themselves. They can put their fingers on the edge of a table and just very gently try to extend them for maybe 5 minutes, 3 or 4 times a day. They could do that at their desk while they're watching something on the screen. Very simple to do those things, and it is totally reversible. Okay, question number 2.
That's what I wanted to know, if it was reversible.
Yep.
It is.
Do you have a question number 2? Okay, we're off and run. Okay, we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to California. And Bahar, you're on with Dr. Wallach.
Hello, Bahar, you're on the air.
Hi, Dr. Wallach. I've been diagnosed from hiatal hernia 4 years ago, and I'm still suffering. So air stuck on my chest, and it gives me panic attacks. So it's just now, a few days ago, I ended up in the hospital, and then they did ultrasound. They said my liver is clean, my gallbladder is clean, 70 kind of different blood tests. They said that's perfect. So I'm
okay. Now, wait a minute. Did you say you had a hiatal hernia?
Yeah.
Okay. So a hiatal hernia is when you have a defect in the diaphragm, and things from your belly cavity. It could be fat. It could be intestines. It could be part of your stomach. Anything can wind up inside of your chest cavity. And if you have intestines up in your chest cavity through this hiatal hernia, and they get gas in them, they're a space-occupying thing, and they can certainly cause chest pain. And so, basically, how much do you weigh, Bahar?
140, and I'm a 5'8".
Okay, so you're slim. All right. And here's what you need to do. Number one, you need to put a 2x4, a board, okay, a 2x4 board underneath the legs, the head of your bed, so your head is going to be 2 inches above your feet. So when you're sleeping at night, gravity is going to help for 6 or 8 hours pull all the intestines and belly fat stuff out of your chest cavity through that little hole back into your belly cavity. So gravity is going to help you here when you raise your head 2 inches higher than your feet for sleeping, okay? And so let gravity help you out there. Also, I would suggest you eat 4 small meals a day, and as opposed to 3 big ones or 2 big ones. And you want to avoid eating anything that produces gas. So you need to have your stomach sterile, so there's no possibility of yeast and bacteria growing in your stomach and producing gas, which then puts pressure the wrong direction on that hiatal hernia. And so I would have you take, at 140 pounds, I'd have you take 1 healthy brain and heart pack per month, 1 healthy brain and heart pack per month, divide it in half, take a half a dose of breakfast, half a dose of dinner with meals. And then I would also take the ultimate enzymes. I would take 1, 2 minutes before each meal, with a couple ounces of water. And it has stomach acid in the ultimate enzymes, which is going to help you maintain an acid environment inside your stomach, which will keep it sterile so bugs won't grow in there. And then you might try some of our wonderful probiotics in our triple treat chocolate, our root beer belly. And then call me every couple of weeks. Let me know how you're doing. We'll walk you through this. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's stay in California. Head to Teresa. You're on with Dr. Wallach.
So, Teresa, you're on the air.
Yes, hi, doctor.
Hi.
I have my friend's father. He has been in dialysis. He has heart tissue problems, digestive problems, and he gets sleepy after meals. He wakes up during the night. He's taking cholesterol medication, and he takes the dialysis 3 times a week, and he is able to urinate because there's some people, she told me, that they can't. He can.
Okay, he is urinating.
Yes, he is.
So he has heart problems. He's got reactive hypoglycemia because he gets sleepy after meals. Okay. He needs to get off of the cholesterol medication. Okay. He does not need statin drugs. That's a negative. He can wind up with cholesterol deficiency problems, which would include low T, erectile dysfunction, ED, adrenal exhaustion, and also Alzheimer's disease. So he wants to get off the statin drugs as quickly as possible. Also, how much does this guy weigh, you think?
He weighs 190, and his height is 5'11".
Okay. And I heard the heart part, but did he have any diabetes?
No.
Okay. All right. Well, 190 pounds. Again, and this is to support and promote maintenance, repair, and physiological function of heart tissues, proper sugar levels in his blood, support healthy metabolism of sugars and carbohydrates at the cellular level. And then when somebody's on dialysis, there's almost never anything wrong with the kidneys. what happens is the creatinine goes up because the kidney is not actually getting the dirty blood to filter. And so what we have to do is get the kidney filtering the blood, but it can't get the blood because the arteries that carry the dirty blood into the kidney are blocked. And so what we do for this guy is get him on 2 healthy brain and heart packs per month. That is 1 per 100 pounds of body weight, so 190. You have 2 healthy brain and heart packs per month, a full dose of each of the products in that pack at breakfast and dinner. And then he also needs the Ultimate Daily Classic Tablets, Ultimate Daily Classic Tablets. I'd have him take 3 times a day. That'll be 3 bottles a month, and that'll support healthy blood pressure and support healthy blood flow through obstructed arteries. He also needs 2 of the Ultimate Cardio Sticks a day, 1 at breakfast, 1 at dinner. That'll be 2 boxes a month. They come in boxes of 30. And then he also needs 2 of the Ultimate Niacin Plus, 2 at breakfast, 2 at dinner time. That'll be 2 bottles a month of the Ultimate Niacin Plus. And the Ultimate Daily Classic Tablets, the Ultimate Cardio Sticks, and the Ultimate Niacin Plus are designed to support and promote healthy blood flow through obstructed arteries and support healthy blood pressure. And it comes from all different directions. And, of course, with heart issues, does he have artery problems? Did he have stents or bypass surgeries? Or does he have congestive heart failure? What has he got?
No, none of that.
Okay. All right. And so let's go this direction. And give me a call every couple of weeks, and we'll walk you guys through this. All right. Doug, let's go to callers.
Let's head to Venice Beach, California. And Mike, you're on with Dr. Wallach.
Well, Mike, you're on the air.
Good afternoon. How are you doing?
Fine, sir. Thank you. How can we help you?
I'm calling about, I've been with a doctor, several doctors. I have high blood pressure. I've had it for over 7 years, and they keep giving me the same products just to control it. And there's so many side effects that I'm tired of taking that, and I'm looking for a naturopathic, homeopathic doctor. If you could recommend someone or something that would help me get away from these doctors. That,
sure. How much do you weigh? How much do you weigh, Mike?
228.
Okay, and how tall are you?
I'm about 5'9".
Okay. At 5'9", I'd like to see you weigh 180, maybe 175, 180. So you need to lose about 50 pounds or so. So let's think about that. Do you have any other issues? Any diabetes? How about, well, you have high blood pressure, diabetes, arthritis, anything like that?
I don't. I take plenty of calcium, and so I'm not calcium deficient. I have never had any arthritis pains, and I'm doing pretty good, I think. I do have.
Okay, so
go ahead.
Any skin issues?
Any what?
Skin, like eczema, dermatitis, psoriasis, rosacea?
No.
Okay. Do you have any bowel problems? Any constipation, diarrhea? Do you have your appendix out? Any colitis?
A little bit of on the diarrhea, and then prostate, a little bit of a drippy symptom.
Mm-hmm. Okay. All right. Well, what I would do is this. And first of all, you got to get rid of all the bad foods out of your life. And because you have kind of alternating constipation and loose stool here, I'd get you on a gluten-free diet. No wheat, barley, rye, or oats. That'll be for a lifetime. No wheat, barley, rye, and oats. And that would include, you got to watch the dog food, cat food, bird food, fish food, read the labels, make sure they're gluten-free. Anybody you're living with in the house, renter, partner, wife, mother-in-law, kids, everybody's got to be gluten-free. Otherwise, you're not gluten-free. And then I need you to take 2 of the Healthy Brain and Heart packs per month. And this, of course, it has multiple products in there. And this is going to support and promote physiology and the basic needs of your genes, DNA, RNA, and telomeres, just to maintain yourself. And also, it's going to give you some nutrients, some of which, when you're deficient in them, it can contribute to high blood pressure. All right? And then, of course, high blood pressure can be caused by blocked arteries, and so causing the space to be smaller in your blood vessels, which then drive the pressure up. So that's a possibility. So I would start out with 2 Healthy Brain and Heart packs per month. 2 Healthy Brain and Heart packs per month, a full dose of everything twice a day out of those packs. And so those 2 Healthy Brain and Heart packs will last you a month. You need to take this forever, okay? As these are nutrients you need. They're not in your food anymore. And then I would also have you take the Ultimate Daily Classic tablets. I'd go ahead and take 3 of those 3 times a day. It'll be 3 bottles a month, 3 at breakfast, 3 at lunch, 3 at dinner. I would also take the 2 Ultimate Cardio Sticks, 1 at breakfast, 1 at dinner time. You need 2 boxes a month. They come in boxes of 30. And also 2 bottles a month of the Ultimate Niacin Plus. That is 2 for breakfast, 2 for dinner. And those 3 products, the Ultimate Daily Classic tablets, the Cardio Sticks, and the Niacin, are going to support and promote healthy blood pressure. They'll support healthy blood flow through obstructed arteries. And the constipation should be resolved by getting on a gluten-free diet. And we will have you call us every couple of weeks and give us a progress report. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 9 for Life Crusade. And Doug, let's go to callers.
All right, let's head to Texas. And Richard, or actually Indiana. And Richard, you're on with Dr. Wallach.
Hello, Richard. You're on the air.
Yes, sir. My name is Richard Cannon. I'm from Indianapolis, Indiana. Sir, I've had Crohn's disease and used steroids for 50 years. It caused adrenal insufficiency. I also crushed 5 vertebrae in my back. Of course, I have malnutrition and dehydration. What is your suggestion, sir, to help these problems?
Okay. First of all, what do you weigh, Richard?
Well, I did weigh a biscuit under 200. Now I weigh about 150.
Okay. It's kind of highly unusual. When you're taking steroids, you usually gain weight. Okay. Now, were these steroids given to you by injection or orally?
Orally, sir.
Okay. And how tall are you, sir?
I was 5'11 3/4. Now I'm about 5'7" since the 5 fractured vertebrae.
Okay. All right. Well, Crohn's disease is a very simple disease to get rid of. Crohn's disease should take you less than 90 days to get rid of it. And sometimes, depending on the degree of symptoms, you can actually be asymptomatic within a couple of weeks. Okay, and then you can take ultrasound every month, and you'll see it getting better and better and better and better. Crohn's disease is a serious, potentially life-threatening manifestation of gluten intolerance. So yourself, your dog, your cat, bird, fish, spouse, partner, mother-in-law, renter, anybody living in the house with you has to be gluten-free because of cross-contamination in the bed and the food preparation surfaces, the laundry, and the couch where everybody watches TV. So nobody in the household. You cannot work as a baker. You cannot work in places where they sell gluten foods and things like that. Okay? Then you have to get rid of all the inflammatory stuff. That means absolutely no fried foods, no processed meats with nitrates and nitrites. It means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. And then absolutely no oils, no microwave popcorn, no theater popcorn, no olive oil, no coconut oil, no margarines, mayonnaise, salad dressing, cooking oils, and no gluten, no wheat, no barley, rye, and oats. You got to watch the beers you drink. There's only a few gluten-free beers. The one I know of is Red Bridge from Anheuser-Busch. Okay, and of course, red wine is gluten-free also. Then, at 150 pounds, and because you have all these problems, I'd have you take 2 of the Healthy Brain and Heart packs per month. That's our sort of heavy-duty pack, okay? It has several different products inside the Healthy Brain and Heart pack. I want you to take 2 of those per month. Take a full dose of each of those products at breakfast and a full dose of each of the products at dinner time. This would be for life, okay? Then for the adrenal stuff, I want you to take the, let's see here, the D-stress capsules, capital D like David dash stress. And it has a whole series of nutrients in it, plus adrenal substance, which will support and promote healthy adrenal function. And then I want you also to take the either root beer belly or triple treat chocolate to get the probiotics. You can take probiotics 4 or 5 times a day. And then I want you to get the glucogel. I want you to get 2 large bottles of our glucogel, which will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. You might even gain back a little of that height. And you're going to take that for life. Also, we have another product which we call Immortalium. And Immortalium supports the function of stem cells and encourages your body tissues that are damaged and injured to make more stem cells, and encourages those stem cells to do their job, which is to rebuild stuff. Okay? So it's called Immortalium. I have you take 2 of those tablets twice a day. It's 2 bottles a month. And call us in 2 weeks, 4 weeks, 6 weeks, 8 weeks, and so on, and we will walk you through this, Richard. Okay, everybody, really great testimonies and questions today. Thank you so much, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.